Let's learn about strokes. The two primary types of strokes, ischemic and hemorrhagic. The two types of strokes are different in their nature, so it's important to understand what type of stroke someone might have had in order to better determine a course of treatment and what the projected therapy outcomes might be. The first type of stroke is called an ischemic stroke. This is much more common and is caused by a blockage. What I mean by that is there is an artery that gets blocked by some sort of material. Typically that's plaque or buildups of lipids. What happens is that artery gets a blockage. So nothing can get past where that blockage is in that artery. What happens then is blood isn't able to pass through because of that blockage. Blood carries oxygen, and that's what makes the tissues work. When that blockage is there, nothing can get past it. That tissue on the other side isn't able to get an oxygen supply. And when something can't get oxygen, it dies. Essentially, that brain tissue dies. When we talk about the clot busting medication, what that's doing is busting that blockage out of there to allow blood to pass through, thereby reoxygenating or making that tissue work again. That's why those clot buster medications are so important. But that's also why it depends on what's going on if that's going to work. The other type of stroke is called a hemorrhagic stroke or a bleed-based stroke. When someone talks about having an aneurysm, so where that blood vessel bursts and they have blood that goes into the brain, that's considered a type of hemorrhagic stroke. That's a simplification of it, but an easy way to understand. When someone has that bleed or that brain bleed, hemorrhagic stroke, bursting aneurysm, all sort of group it into one category, the blood gets onto the brain tissue. Blood is typically toxic to tissues. So what that means is when that blood gets on the brain tissue, the tissue dies. And that's what causes the damage in a hemorrhagic or bleed-based stroke. That is a very oversimplified version of everything, but I hope that helps for understanding. Follow Baby Grand SLP for more educational content from the beginning to the end of life.